Welcome to the Safe Staffing Programme bite-sized video giving a general overview of the Health and Care Staffing Scotland Act 2019. The bill for this Act of the Scottish Parliament was passed by the Parliament on the 2nd of May 2019 and received royal assent on the 6th of June 2019. It was delayed due to the COVID-19 pandemic and enacted on the 1st of April 2024. This primary legislation is the first workload and workforce planning legislation for the NHS and social care in Scotland. Key drivers for introducing the Act include Everyone Matters 2020, which was published by the Scottish Government in June 2013. It focuses predominantly on health, but from that came a Workforce Vision Implementation Plan, the latest one being for 2018 to 2020. The introduction talks about a changing landscape and the continued rollout of health and social care integration being the key drivers to deliver transformational change across health and social care. The Health and Social Care Delivery Plan was published by the Scottish Government in December 2016. Referring to this plan, they spoke about the reform of GP services, primary care and social care services, including integration of health and social care. At the RCN Congress 2016 in Glasgow, the then First Minister of Scotland, Nicola Sturgeon MSP, announced her intention to introduce legislation for staffing for safe and effective care. There are four main sections of the Act. Part 1, the guiding principles, and Part 3, staffing in care services, are the relevant sections for social care. Part 2 relates to staffing in the NHS, and Part 4, the general provisions, describe the entitlements of the Scottish ministers to enact or modify the legislation. The Act applies to all care services registered with the Care Inspectorate, all local and integration authorities when planning or securing the provision of a care service from another person, and the Care Inspectorate when developing staffing methods in collaboration with the sector. The new Act replaced Regulation 15 of the Scottish Statutory Instruments 2011 No. 210. In general, the ask of the new legislation does not differ much from Regulation 15, with the exception of the well-being of staff. The focus is on staff well-being insofar as it affects the main purposes of providing safe and high-quality services and ensuring the best care outcomes for people who use services. There are also some differences for specific services to do with a staffing method, which the Scottish ministers may mandate at a future date. Please refer to our other bite-sized videos for further information on the sections of the Act. These are available on our Hub page. Thank you for listening.